A new, more rapidly spreading strain of the coronavirus is a particular concern for African Americans. Rates of infection and death continue to disproportionately impact Black America. According to the COVID-19 tracking project, more than 57,000 Black people have died from COVID. In fact, Black Americans make up 16% of all COVID-19 related deaths in this country, more than 1.5 times the mortality rate for white Americans. I want to bring in Freeman Hrabowski III. He is the president of the University of Maryland, Baltimore County, and last fall, he and his wife entered the Moderna vaccine trial. First of all, Dr. Hrabowski, thank you for joining the trial. As you are no doubt aware, and as our loyal viewers know, having people of color join was absolutely essential to measure the safety and efficacy for all Americans. What led you and your wife to join the trial?
Right. My wife Jackie and I decided to do this first because my graduate, one of the graduates of UMBC, is the lead scientist, NIH scientist, Dr. Corbett, in creating the vaccine.
Yeah.
We're very proud of that. And she and I talk regularly. And she had said to me that, unfortunately, people of color, and particularly African Americans, were not trusting this vaccine. And we needed more to be in the study to show that we believe in the science.
And I do want to ask you a little bit more about Dr. Corbett, but as I said in the intro, part of the mistrust stems from very real concerns about what has happened in the past. In fact, as I was discussing this segment with my producers, we had a debate about how much to focus on Tuskegee, on Henrietta Lacks, but as part of that discussion, I think I came to realize that until we acknowledge that history, we really can't convince the people who are most affected by the virus to get the vaccine. I'm wondering, both Dr. Hrabowski, if you had any reservations about taking part in the trial, and then also how you have been able to convince people who have been hesitant because of that genuine mistrust stemming from really horrific past abuses of the Black community to get on board with this.
You have to start with the truth. There's no doubt about that. As a mathematician, I will tell you, to solve a problem, you have to first state it, look at it from different sides, and in order to understand what must be done. I grew up in Birmingham, and all of my life I was aware of racism, of the way we were treated, of what was happening in Tuskegee with the Tuskegee syphilis study. We all talk about it as if it's something that's so far away, but it really is not. If you look at those photos, you understand the devastating impact of racism on our society and the fact that people of color, African Americans, have not been treated well. There's been all kinds of mistreatment. Now, with that said, there are several things I say and that my wife and I say to people as we talk to them. Number one, we can be very proud. We've made progress in this country. When I can tell you that we've got a Black woman who is at the forefront of creating this vaccine, lead scientist, Dr. Corbett, it's a big deal. I've got graduates who are also on the side of Moderna, Ph.D.s in science, African Americans. So for the first time, we're seeing people of color involved in the development of the vaccine itself. Secondly, the question we have to ask people is this: if we don't do this, what will be the outcome? Clearly, more people will die, and we have to keep saying the truth. More Blacks and Latinos are dying than any other group proportionately, and that has everything to do with health care and access, but it now has to do with whether or not we can convince people to take the vaccine. We must teach people to believe in the science, and we must continue to focus on having more people represented in the scientific workforce.
Well, as I mentioned, you and your wife did receive the vaccine. Let me be clear, because you were part of the trial. Do you know if you received the vaccine or if you received the placebo?
Yes, this is a weekend for celebration. We went for the unblinding, as it's called, when you don't know whether or not you were in the placebo group or the other. And I had been saying, Jackie and I both have been saying, we really believe we got the vaccine. This is at the Center for Vaccine Development at the University of Maryland Medical School. It was an amazing experience. And I just felt that I had gotten that vaccine because not only was my arm sore after the second injection, but we were really tired for couple of days, and I was feeling a little loopy. And my wife would tease me and say, but you're always loopy. So we really didn't know. But we went yesterday for the for the unblinding. And when we did, and they went through the process, we both had gotten the real deal. So we have been vaccinated. We had the first shot in September and then in October. So it was a moment of celebration. So we called everybody to say, you've got to get the vaccine.
Congratulations. Well, let's talk about access, though, to the vaccine, because not only is part of the problem that we're fighting against the mistrust in communities of color for science and for this vaccine in particular, but also access, that there is a limited supply. The communities that are being most affected are communities of color with the highest death rates, the highest infection rates. And I guess my question to you, Dr. Hrabowski, is how do we make sure not only that people are on board and are willing to get the vaccine, but that they're getting to the communities that are being most affected?
Sure. I think we have to think out of the box. A lot of people don't have emails. They may not be looking at a program that's talking about this way. And so whether it's in churches or in community groups, we have to think about how to reach the people in these communities. And the other part is we need leaders and people who believe in science to step forth and to say, I've done this and I know I'm doing the right thing. And I think the part that will help people of color is that so many really are selfless and want to help other people. What we have to say to people is we're not taking this vaccine just for ourselves. We're taking it for our children and our parents and our grandparents, because we can, even if we're not feeling any pain, even if nothing is bothering us, even if we get COVID, the fact is if we spread it to people with conditions, we can be responsible for them having a very bad time and perhaps dying. So it's not just for us that we're doing this. We're doing this for humankind, for our relatives, our friends, and others. Very important.
As I promised, I wanted to get back to Dr. Corbett and her contributions to creating this vaccine in a historically short amount of time. When you're talking to people, trying to convince them that the vaccine is in fact safe, that it is backed by science, and that it is important to take, how much does knowing Dr. Corbett, knowing her work, knowing that she is an African-American woman and a scientist and at the very cutting edge of this technology and this research, how much does that go into solving for what has been so long a missing factor in knowing that these vaccines, that this medicine is not being developed by another group, but is actually being developed by a doctor like Dr. Corbett?
Right. It's very important. I will tell you, as I have said, that one of our graduates produced this vaccine, was the lead scientist along with Dr. Graham. People don't want to believe it at first. I have to show them. I showed them recently the CBS show with Michelle Miller. And they are stunned. They really did. Michelle Miller did a great job in working with us and the other shows that have been on. Yesterday, Vice President Kamala Harris talked about Dr. Corbett, this 34-year-old African-American woman. It's a great story coming out of rural North Carolina, coming to UMBC, going back to Chapel Hill, becoming a postdoc at NIH, having this intellectual curiosity and this passion. And so the significance is it will not only convince people it can happen, it will say to little girls of all races, this is what's possible. You can create a vaccine. It's such a transformational idea, especially at this time of Dr. King's birthday, to be able to say to Dr. King that we have produced a little black girl who becomes a wonderful world-class scientist who is saving lives. That gives me goosebumps. And as people hear the story, it will give
you can see mine too.
Yeah.
Yeah, no, that is it. Dr. Freeman Hrabowski III, it has been a pleasure speaking with you, sir. Thank you.
Thank you. Take care.